Welcome to today's episode of the E84 podcast, where we'll be exploring the world of onychoscopy, a non-invasive technique that can help dermatologists diagnose nail abnormalities with incredible accuracy. Our experts, Prof Bianca Maria Piraccini, Dr Michela Starace and Dr Matilde Iorizzo, will be discussing the benefits of examining the nail unit and all its components with the aid of a dermatoscope, and why this is essential for differential diagnosis of conditions such as nail psoriasis and onychomycoses. You'll learn how onychoscopy can provide practical information about the dermoscopy of the nail plate free edge and hyponychium, and how it can help us to identify early signs of nail disorders, potentially saving patients from invasive diagnostic techniques. But before we get into that, save the date for our upcoming symposium hosted in Seville, Spain, 18th to the 20th of May 2023. Discover the latest scientific updates across acne, pigmentary disorders, atopic dermatitis, pediatric dermatology, and more. The symposium format offers you the chance to meet leaders in your specialty from all over Europe and beyond. Stay tuned for more. We are joined by Prof Bianca Maria Piraccini, who is full professor for skin and venereal diseases in the Department of Experimental Diagnostic and Specialty Medicine at the Dermatology University of Bologna, Dr Michela Starace, who is a junior assistant professor in the Department of Medical and Surgical Sciences in Bologna, and Dr Matilde Iorizzo, who is a dermatovenerologist with a specific area of interest in hair and nail disorders. Stay tuned as we delve into this exciting area of dermatology and discover how onychoscopy changes the diagnosis of nail disorders. Enjoy the episode.
Hello. Today we are going to discuss the paper that appeared on the Journal of the European Academy of Dermatology that covered onychoscopy of the distal margin of the nail. Matilde, why did we have the idea of writing this article?
We had this idea because onychoscopy is very important technique to magnify the small details you can see in the nails, and we realized that very often the hyponychial area was not checked by residents, by colleagues, and so we believed it was really important in some situation to check that area to find the correct diagnosis. We started, if you remember, many years ago with the dermoscopy of the hyponychium to check the capillaries, to make the distinction of psoriasis and lichen planus. Michela, you should remember that study. And so we started from them to move to pigmentation, to infections, and to tumors. I know Michela see many cases of tumors and infections, so she can tell us how this technique help her in the diagnosis, in the everyday diagnosis.
Absolutely true. I think the first paper that you wrote about it underlined very well the role of the onychoscopy on the hyponychium, especially the inflammatory disorder, because you can appreciate the typical dilated capillaries when you suspect psoriasis. And until now, we perform it in a very high magnification because it's important to use 45 magnification, and you can appreciate this capillary, and it is that especially in other diseases, baby can appear with the onychomycoses. First of all, when we have onychomycosis, we can look at the free margin and onychium with onychoscopy to distinguish onychomycosis versus psoriasis and traumatic onychomycosis. And we have another paper in the past that Professor Piraccini wrote, and I was happy to contribute in this paper because with onychoscopy, there is the technique to distinguish especially onychomycosis. It is right?
Yeah, it is important to see that if you apply just the dermatoscope to the free margin of the nail, you can see the nail plate, which can be thickened, thinned, or of a normal thickness, can be colored. This is particularly important when we deal with melanonychia, because the level of the pigmentation can be low or high, indicating the presence of melanocyte that produce the pigment in the distal or in the proximal matrix. But some tumors can be seen very well looking at the distal margin of the nail. Matilde, you have looked a lot at onychomatricoma, isn't it?
Yes, correctly. So onychomatricoma and onychopapilloma are probably the two most commonly encountered tumors where onychoscopy of the hyponychium is very useful. Onychopapilloma is much more common in daily practice than onychomatricoma. But if you look with the dermoscope at the hyponychium, you can easily make the diagnosis, because with onychopapilloma, you see the warty lesion that is easily indifferential with wart, with the viral wart, because there is absence of collarette. So you can easily see that it comes from the matrix and it's not an infection of the hyponychium like viral warts. The same is for for onychomatricoma, because if you especially clip the nail plate, you can see the holes typical of that tumor. So in each hole there is a digitation of the tumor, so you can be quite sure of what you are dealing with.
And onychomycosis, you see the scales under a normally thick nail plate, isn't it? The ruin like scales, which can vary in color, so can be orange to yellow or sometimes even black in pigmented onychomycosis. And this can allow differential diagnosis between onychomycosis and nail psoriasis. Michela?
Yes, because in psoriasis we have especially homogeneous colors like whitish color, and sometimes maybe a little bit yellow. But especially when you have this various color with this orange, yellow, we have to suspect onychomycosis. Another important role is to distinguish also in onycholysis versus traumatic onycholysis, where we have no scales. So we can have an empty space under the nail plate. This is very important because, when arrive a patient, before us, it's always an onychomycosis. But with the typical appearance of the onychoscopy of the hyponychium, we are sure, and also we can use it to look at where is the best place for prepare the sampling for the confirmed diagnosis with the cultural examination. And I think also there is another tumor, maybe we can use onychoscopy in hyponychium. Do you remember the subungual exostasis, the paper about it, Professor Piraccini? It is very nice paper.
Yes, when you look at subungual esostasis, you see a nodule underneath the nail plate. So it's not a thickening of the nail plate, but is an uplifting and detachment of the nail plate due to a nodule, which can also show dilated vessels that are typical. And it is very simple to diagnose a subungual exostosis because a simple, quick, and not expensive X-ray can confirm the diagnosis. And then, of course, surgery is the most important treatment. But don't forget to use your dermatoscope in the periungual tissues, even when you have an ulcerated mass of the nail, because you might see the Hutchinson and the micro Hutchinson sign. And Michela and Matilde are now coordinating a task force who is describing these two entities.
Exactly. So I think that the maybe most people believe the Hutchinson is a periungual at the perionychium sign, but in many situations you have an Hutchinson sign at the hyponychium, and sometimes is very tiny, very small, and covered by the plate. So it's important to look at that area, and sometimes also cut the nail plate to see better what is underneath, and not only the pigmentation but also the capillaries, because you talk about melanoma, but don't forget the squamous cell carcinoma that has a very vascular chaos or something like that, so nothing is regular, and that should arise the suspicion that you are dealing with a tumor and not with a wound or an ulceration or a pyogenic granuloma, where the vessels are much more regular. But as you know, it doesn't exclude malignancy. So facing a pyogenic granuloma doesn't mean that you are facing something benign, but that could be something malignant. So it's very important to take a look at every part of the nail unit.
Yes. So look at the nail frontally, and also at the distal margin. This is the place you should apply your dermatoscope. Look at the nail, look at the hyponychium, look at the color, and look about scales, detachment, and whatever. Any
And use
addition?
direct magnification. So if you are sure, especially as Professor Piraccini told before, especially to exclude the micro Hutchinson sign, because it's the real role, one of the most important role of onychoscopy is also to appreciate the micro Hutchinson sign, because it is very helpful for maybe in a melanotic melanoma. And only with the high magnification we can distinguish the deposit of melanin. And so don't forget to use it to play with the onychoscopy in the different part to be sure at the end of the diagnosis.
And I want just to add something that I know for both of you is very important. So when you clinically see that there are scales, don't use an interface solution. So always perform the two techniques, the wet technique and dry technique. But when you see scales, don't use an interface solution. Otherwise, the scales will be covered by the liquid you are using, the ultrasound gel, and you don't see what you really have to see. So always perform the two techniques, dry first and then wet if necessary.
So apply your dermatoscope on the dorsum of the nail plate, on the periungual tissues, and then on the distal margin on the of the nail plate and hyponychium to observe all changes. This is the message of our article, and I hope you have already read it. If you are not, please do.
Thank you so much. Thank
Thank
you
you
to
so
all of
much.
you.
Thank you very much to all of you.
Before you go, a quick favour. If you are a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you are interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode. Thank you for your support, it means a lot. We look forward to hearing from you. Until the next episode, take care of your skin.